The OSU study is the largest of its kind, with data from more than 100,000 births over 7 years' time and statistics from all 50 states. What researchers found is that for healthy mothers and infants, home births appear just as safe as birthing center deliveries supported by doctors.
If there have been no complications during the pregnancy and if the labor is moving along smoothly, then the research suggests that it is safe to go ahead and have that birth at home.
But Oregon State University professor Melissa Cheney, author of the study, says there are caveats.
If you want an epidural, if you're requiring a cesarean birth or a vacuum extraction, which is a way of helping the baby be born vaginally, then you actually have to move to the hospital to have access to that level of care.
The study combined data sets from 2 national registries for community births with the goal of finding out whether home births or birthing centers were safer.
And what we found is that there are no differences between home and birth center birth.
Cheney said improved technology helps midwives or nurses track fetal heart rates and vital signs, and that births are conducted no more than 30 minutes away from a hospital, so that in case of emergency,
we can either get into the car and go into the hospital, or we can call 911 if it's urgent.
But there are concerns about home and birth center deliveries in the broader medical community. The American College of Obstetricians and Gynecologists states on its website the safest place to give birth is a hospital. It warns home births pose a twofold risk of perinatal death, meaning during pregnancy, birth, or infancy. Professor Cheney does note that data shows about 90% of babies are still delivered by doctors. But with more understanding, she believes sharing information between all caregivers is what's missing.
We need a more integrated system where we have a better understanding of what's occurring outside of the hospital as well as inside the hospital.
Oregon and Washington both have strict rules in place for when an expecting mother at a birthing center must be transferred to a hospital if the delivery becomes challenging. If you're interested in learning more about the OSU study, we put a link to it in this story on KGW.com. Libby Dowsett, KGW News.